Our daughter Dionne is a senior staff nurse at Seng Hospital.
Oh, when Dionne told us that she wanted to do nursing, initially we were taken by surprise because she had never mentioned that she wanted to do nursing.
She has proven, her commitment by the grades that she has achieved, and we were quite convinced that, that is her calling.
Her persistence, her determination, her compassion made me change my mind. I'm very proud of her.
My nursing journey started when I joined Ngee Ann Polytechnic's nursing program. I was the pioneer batch of Ngee Ann's program, and that was a great experience. Because of the small class size, we had good interactions with the lecturers and were mentored by them throughout our nursing journey. After graduating from Ngee Ann's program, I joined Seng Hospital and was fortunate to be rotated through different disciplines to be exposed to the medical discipline, the surgical wards, and the research units. I was really excited to be awarded the Ministry of Health scholarship to read nursing at the University of Pennsylvania. It is one of the best nursing schools in the US, and all the nursing professors and scientists and researchers that we've been reading about in Singapore are now actually going to be my faculty. They're going to be teaching me over there.
She's young, very energetic. The first time when I met her, and I said she's the right one for nursing. And as a young MOH scholar, she knew that there's a lot of expectation from her. But she's always willing to take on more, and I'm truly inspired by her.
When I further my studies, I believe it is not just studying for myself, but for the hundreds of patients that will cross my path one day. What happens if the patient develops? Although I really loved the US lifestyle, I decided to return back to Singapore and rejoin Seng to serve the people in my own country. I remember visiting my patients in their homes before their knee surgery operations, and I went there to teach them about lifestyle adjustments that they will have to make after their operation. For example, they could no longer wash their clothes by squatting on the floor, but they now had to wash their clothes on a sink because if they squatted, they would spoil their knee implants. And I also told them about lightings. They had to have some dim lightings in their house so that they would not trip and fall on the way to the bathrooms. I encountered a very nice taxi driver on the way to one of my visits at the patient's home, and he asked me what was the purpose of my visit. So I explained it to him. And upon reaching my destination, he told me that he would not collect any taxi fare from me because he said, "You are a nurse, you serve my people, and now let me serve you." These are the little words of encouragement and kind gestures from Singaporeans that keep me going as a nurse. Moving forward, I intend to pursue an MBA in healthcare management. That would equip me with the knowledge and the skills to cope with Singapore's ever-changing healthcare landscape. My personal vision is to be an inspiration for the next generation of nurses. I want to let them know that nursing can be rewarding in many ways. Nursing has changed a lot in terms of job scope. Nurses keep upgrading their skills and take on newer responsibilities that enable them to now perform interesting and challenging work. I believe nursing will always remain a profession when one has to use the hand, the brain, and the heart.